Okay, testing. Good morning. Testing. Good morning. Today is Saturday, April 2nd, 2022. This is our regular Saturday morning class. Sorry, I missed last few weeks because I was traveling overseas for a family health issue, but I'm back. Thank you everybody for joining, and as you know, we mention every time that this session or this class is based on our extensive experience and also some research studies. So today's topic is a self-care is a health care. So let me tell you a little bit what does it mean and where the term came from and what is our experience. What is our experience is that we as a Western trained physician, we work in a system called a health care system. But instead of health, what we provide is called a disease care. Health is not that easily understood by the Western trained physicians. If you ask a Western trained physician, they will be talking about diseases, up to the extreme, at the cellular level, at the genetic level, at the receptors level. But if you ask them simply what health means or define a health, they will be stumbling a few times. In yoga and Ayurveda, health has been defined very simply. Definition of health in yoga: balance of your body, mind and spirit, balance between right and left side of your brain. Ayurveda, health is defined as a samadosha, samagnika, samadhatu malakriya, prashanna atta indriyamana shastho iti obhidhayate. Samadosha. Doshas are body's psychophysical body type, vata, pitta and kapha. They are in balance. Sama Agni. We have our digestive fire. We have a fire within us called tejas. Our fire is in balance. Samadhatu malakriya. Samadhatu, dhatu means our body tissue. 7 body tissues are in balance. Malakriya means proper elimination without much effort in it. Effortless elimination, smooth elimination. Prashanna Atta, your soul is very content. Indriya Mana, Indriya means our five senses, our five senses connected to our mind properly. Shastha iti obhidhayate. Shastha means health. This is the definition of health. So everything in balance. Shastha means health in Sanskrit, also comes from the word called sha, that means self. Sthir means stillness. Stillness in your body, mind and spirit. Asana, poses. Sthiram, sukham, asana. Stillness, happiness and a pose is your health. Effortless breathing is your health. Effortless meditation is your health. So what it boils down to is that we can buy a disease care. We can go and pay a doctor, see a doctor, we can pay and get my operation done, we can get anything done, we can buy the medication, we can go to the hospital for a proper payment, we can get a disease care. But for health, we have to earn it. Nobody is going to provide you the health. You have to earn yourself, and that earning is through your self-care. That is exactly our whole experience. People like us means all of our yoga teachers, yoga practitioners, we've been practicing for a long time. We develop a daily routine called DINACHARYA. We developed a lifestyle modification. We do a daily practice. That brings our health. So starting with first is that the best way to look at the therapeutic outcome of a yoga, which is called yoga therapy, is based on a person's daily routine. It's called DINACHARYA. Daily routine is based on your psychophysical body type. What is psychophysical body type? Those are called doshas. Simply speaking, that our body is in tune with the nature. Body is called a microcosm, nature is called a macrocosm, and we call it in Sanskrit Jatha Pindo Tatha Brahmando. Universe is made of 5 elements. It's not a Big Bang theory. First it came space. In the space came air. Air had a friction caused fire. Fire melted the cloud to form water. Water froze into earth. Space, air, fire, water, earth, and all the 5 elements are inside our body. We have a little disproportionate portion of the elements which creates our psychophysical body type. People who have a little bit more of space and air. Air is mobile. Person who is mobile, they're always moving. They cannot sit down in one place. They're always talking. They're doing 10 different things at the same time. Mobility is people called vata. These people are very prone to neuropsychiatric and musculoskeletal disorders. People who are very precise, pretty controlling, very angry. People have a, like we call it, a very heat inside their body. It's called a pitta. Their attributes are primarily the attributes of fire. They're fire, they're controlling. The type of disease they develop primarily is an inflammatory disease and also disease of the solid organs. Liver, heart, small intestine. They reside in the small intestine. Vata resides in the large intestine. And the people who are totally grounded, they are sort of not even connected to the environment. They need 3 pushes to move around. When they're grounding, they're grounding. People they call kapha, they have attributes of water and earth. But at that time, body is less functional even. They reside in the stomach. So, all these 3 called Vata, Pitta and Kapha is also being connected with a clock, which is called Ayurvedic clock, and also our nature. In Ayurvedic clock, it is a segment of 4 hours. Morning 6 to 10 is a Kapha time. In a Kapha time, our digestive fire is very low. Try not to eat a heavy meal in that period of time. And do all the uplifting activities, because Vata is grounded, and a daily practice is called your balancing, and balancing is called law of opposite. Law of attraction creates ill health. Law of opposite creates health. Morning 10 to 2 is called a Pitta time. In a Pitta time, our digestive fire is called Agni, very strong. Tikshna Agni. That is our main meal. Lunch is our main meal. We do all the cooling practices at the time. Afternoon 2 to 6 is a Vata time. Vata is very mobile, very erratic. They don't have any routine. So try to do some routine stuff. Try to do some your exercise, treadmill, weight training. On the other hand, in the morning, during Kapha time, you do yoga practices. The cycle turns again, saying in the evening 6 to 10 is a Kapha time. So digestive fire is poor or less, called Manda Agni. So your dinner has to be smaller. Dinner about half the size of your lunch, dinner about almost 2 to 3 hours before your bedtime. Because if you eat a big meal and go to bed, your body is not functioning, the food is not properly digested, you develop some toxins, which is called ama, and that is, we call it a mother of all the illnesses. Ama, A-M-A, ama. At night, 10 to 2 is again a Pitta time. Your digestive fire is strong again. What it does, it cleanses your body. It's like a self-cleaning oven. Like all the impurities you put inside your body throughout the whole day by eating whatever kind of food you ate, it's going to digest. It's called a self-cleaning oven. And at night, 2 to 6 is a Vata time. Again, it's a mobile, erratic time. So generally you wake up between 4 to 5 in the morning hour, which is called a Brahma Muhurta. It is the time of the divine. Divine wakes up at the time, very calming, cooling, and Vata pacifying time. So let's look at what is the self-care we're going to be doing. Eventually what happens, that self-care is built into your body and mind, that you keep doing it effortlessly without knowing. Example, you're brushing your teeth. You've been brushing your teeth long enough that your brain got a signal which is called neuroplasticity. So to wake up in the morning, you don't have to think about that I have to brush my teeth. Also, what happens, your body and mind gets a signal. Say, for example, I cannot sit down this place, so I'm sitting like this, I'm having some little bit of a hurting, but if I sit here long enough, have my eyes closed, do my breathing out longer than breathing in, breathing out is parasympathetic, and slowly this thing will happen. Eventually, after a while, I will change my leg, change my foot to activate opposite side of the brain. So what does it mean? What it means is that I am not sitting like this, my brain is allowing me to sit like this. Next thing what happens, that when I'm able to sit like this, or maybe I'm trying to touch my toe, Padahastasana, hand touching your feet, you cannot do it. But you stay here. Again, bring the relaxation response. Remember, in yoga therapy means it is non-competitive. You don't compete with anybody. You start where you are. You progress based on your body's response to that pose or to that pranayama or that meditation. There will be no pain. Breath has to be effortless. You are doing a posture, you are talking, you are singing. Whatever you are doing, you will be able to do that pose. I'm sitting here, I'm doing Kapalbhati Pranayama, I'm doing Anulom Vilom Pranayama, I'm doing everything. I can able to eat in this place, write in this place, effortless ease. It will come to you. Once you get into this posture and slowly you progress, now you're able to touch your feet. Immediately your body and mind has a sense. You know what? I couldn't touch my toe. Now I can do it. Let me see. What is my sleep looks like? Let me see what is my digestion looks like. Let me see what is my elimination looks like. Yoga says very simply, health or healthy person has a strong digestion, easy elimination, and a good night's sleep. If you look at a baby, we learn it from baby, a healthy baby. What does a healthy baby do? Eat, poop, and sleep. Healthy person will do the same thing. When you understand that prana, teja, and ojas. Prana is a cellular communication. Tejas is your cellular contents, and ojas is a cellular immunity. Prana flows through the channel. Prana is flowing freely. Teja is glowing, and oja is building. That's your health. Other outcome of good health is that, in Sanskrit it says Agni Deepana. You ignite your Agni. Ama Pachana. Ama is your toxins from your improper digestion of the food. Ama Pachana. You destroy that toxin in your body. Nadi Shodhana. cleaning up all the channels in your body so that prana can flow. Prana is your subtle energy which keeps us awake, alert and alive. And Ojosthapana, that means Ojos is your cellular immunity. Sthapana means establish. So what we do as a practitioner for a self-care, first, morning we wake up. When you are healthy, you don't need an alarm clock. Wake up with a proper sleep between 4 to 5 or maximum between 4 to 6 in the morning hour. We as a yogis, we sleep on our left side in a fetal position. A lot of reason for it. I have shown it to you before, and generally I show it and I do it and practice when I do the yoga therapy for sleep. We simply sleep, we'll be sleeping. Generally, yogis also don't have any pillows, don't have any covers, so in the left side, and the reason is our inferior vena cava, the main channel which carries the blood to the heart, is on the right side. So we don't want any pressure on that, and also all the intestinal activities are also on the left side. Like for example, if you're doing a yoga for a pregnancy, like a prenatal or a natal yoga, we always on the left side, because we don't want the uterus to press on the inferior vena cava. So the way we sleep is we put our hand, we are in a fetal position, and the hand like this. I really don't need even a pillow. Initially, you will have what is called a little discomfort, comfortable discomfort. You do it only up to the level you can have that discomfort. No pain, effortless breathing. It's a wonderful practice. We have been doing it for a long, long time, and you'll be surprised how good your sleep is going to be. We also do a lot of other techniques during going to the bed, and we'll talk about it a little later. When you get up, straighten up our right leg first, put a little support on a hand, and when you get up, first thing we do not get up suddenly. When you get up suddenly from your sleep, you develop called postural hypotension. Means when you suddenly get up, your blood pressure drops, blood supply to the brain is reduced, you suddenly have a blackout spell or may have a little bit of vertigo, dizziness, you may even fall down. We call it the rule of 90 seconds rule, or maybe 30 seconds rule. Sit down for 30 seconds, close your eyes, do a little breathing, breathing out longer than breathing in for 30 seconds. Stand up, stay for 30 seconds, then you start moving around. It's a wonderful, wonderful practice. Please, please, please try this. Don't get up from the bed suddenly. It's a one self-care practice will bring your health back. One healthcare practice, not to get up suddenly from the bed. Self-care is healthcare. Next, when you get up, we keep a glass of water on our nightstand. And yogic and Ayurvedic tradition, we generally put it in a copper vessel. The copper vessel has been used in India for thousands and thousands of years. And to my surprise, I was visiting India just middle of March. Pepsi, the diet drink maker, in collaboration with the Indian company called Tata. Tata is a very famous Indian company. They have a water, bottled water, infused bottled water is called a Tata copper water. Pepsi has infused copper into the water and marketing it. So we sit down first in a squatting pose. We'll be sitting in a squatting pose. Remember this, these are the self-care. Nobody's telling you how to do it. You are doing it on your own. And you're learning it because you are developing a neuroplasticity. When you sit down, be sure your feet is grounded. Now, I cannot sit down like this. Same theory about therapeutic yoga. You are not competing with anybody. You are listening to the body. You cannot do it. Just get up. Find a place where you can and stay here. Close your eyes. Do the breathing. It will happen. It happened to all of us. We hold the glass. We drink to the water in a gulp. Generally, we do about at least 2, sometimes 3 glasses of water in a lukewarm, in room temperature. When you do it in a gulp, take one, take another gulp. And also we have this health tracker. I have this Apple Watch connected to my iPhone. I get all the information there, here, and also over there. So talking from our benefits. When you have a gulp and sit down, put your hands, separate your fingers, relaxes your hands. You extend your wrist, relaxes your wrist. Put one elbow inside, put other elbow inside. Bring your hands together. Keep your spine straight, eyes closed. And do the breathing out longer than breathing in. Within a short time, you will have a sensation for bowel movement. It happens to all of us. First thing in the morning, we'll sit down, and we're having a very easy bowel movement. Because this posture relaxes your pelvic floor, it also straightens up the kink between your rectum and the anal canal, so it becomes a straight and proper evacuation of your bowel movement. This day and age, when we have a commode, there is a nice gadget in the market called Squatty Potty. You can put a Squatty Potty, which comes as a 6 inches and 9 inches. You can put a Squatty Potty, put your feet, will be exactly the same posture. You'll be sitting in a commode. From here, you learn how to get up without a support. And then you also practice few times. You sit down effortlessly, and this is a sign of health. Able to get up without a support, called as sit, rise, test, is better than any health tracker in Western medicine. It is better than any test, any tracker you have. And I'm showing you in stages how you do it. So once you get up, next thing you do, remember you have your What you will do next time, that when you are sleeping, your body is very relaxed. All the muscle gets relaxed. You will go ahead and put your body straight, like here. You go against a wall, put your heel to the back, touch your hips, your back, and the back of your head. Close your eyes and you breathe out longer than breathing in. Slowly you can get your hands all the way high up, and you stay here between 5 to 10 breaths. Always remember, in yoga you breathe out first, then you are breathing out longer than breathing in. You have been in my pranayama practice, you have seen count of 3 in, count of 6 out, count of 4 in, count of 8 out. I am in a profound level of relaxation. This is a permanent therapy for chronic low back pain. Chronic low back pain happens because of the irritation of a nerve and tightness of the muscle. It relaxes your back muscles. Next, to practice your health, this is you need to practice. You bring a balance back. Before you balancing, how do you balance? You, as I said, when you sit down, cross your feet opposite, or you cross your feet. Say, I'm comfortable standing like this. Going into the law of opposite. Balancing. I'm giving my brain, I'm putting my feet together. This will create a balance. I'm a right-handed, right-footed. I'm sure that I can stand on my left foot as long as I want. This is the way to achieve your health, the self-care. What we do, I'm right-handed, so use your left hand. So in the morning, after this, I'll get into brushing my teeth. When I brush my teeth, I'll brush with my left hand. Initially, when I started brushing my left hand, I had a even problem bringing my brush to my mouth. It will be all over, but slowly when I get it, I see my right hand is moving like this. Because my brain already has a signal that I use my right hand. So I brush my teeth with my left hand, we do a tongue scraping, then we do the neti pot. We have a pot called neti pot with a gel neti. We took a little lukewarm water, put a non-iodized salt, put it through one nostril, it goes out the other nostril, then into the other nostril, goes out, blow our nose, and both the noses are clear. That is, we're ready for our morning yoga and pranayama practice. Practice in the morning is very simple. We do the asana practice, which is very relaxing. We call it a sthiram sukham asanam. Stillness, happiness in the asanas. Then we do a routine, a pranayama practice. We do simple, your first Bhastrika Pranayama, then do Kapalbhati Pranayama, Anulom Vilom Pranayama. Bhastrika is a bellows, Kapalbhati is a breath of fire, Anulom Vilom is alternate nostril breathing. Then you do the Bhramri Pranayam, bumblebee breathing. Then you do a Ujjayi Pranayam, the victorious breathing, or called a psychic breathing. Then we do a little called Shankha Pranayam for a resistive exhalation. We do some cooling pranayama called Sitali and Sitkari pranayama. Then we do a chanting called Om pranayama. Meditation automatically comes when you're properly doing the pranayama practice. So now, bringing the balance back and bringing what a health is. Take a look. What is a self-care is a health care. You cross your feet in the opposite side. My right foot is on the left side. You are able to sit down in this and able to get up without any support. Try it. If you're doing with me, try it and you will see how easy it is, how difficult it is, or how this is going to bring a health in your body and mind. As I always mention to you that I had open heart surgery about 21 years back, but my daily practice with my self-care, I'm off medication, I'm disease-free, I'm enjoying a good quality life, and all my physician friends ask me, you don't take any medication? I said, no. They don't ask me the next question. The next question is, what do you do? What I do is this, put my foot on the other side. Foot on the other side, I'm able to sit down, and I'm able to get up. In stages, impossible become possible. Go another level and show you the exact sign of health. Sit down all the way to the ground. I'm sitting all the way to the ground and my feet are crossed. I'm comfortable. What is my level of comfort? I'm talking, I'm singing, I'm whistling. From here, I will be trying and I'll be able to get up without a support. Try this, sitting down all the way to the ground and get up without a support. If you use your one hand, you lose 25% of your health. If you use two hands, you lose 50% of your health. If you use two hands and one foot, you lose 75% of your health. Show it to me, opposite side. Sitting down, my feet are crossed opposite, sitting all the way to the ground. It's a level of comfort. Very nice level of comfort. You can't beat this. So sitting down here, you are able to get up without a support. Morning practice. In the morning, get up slowly, have a good bowel movement. Remember, carrying that stool in your colon throughout the whole day is the most toxic, ill health you can ever have in your life. Proper bowel movement the first thing in the morning is health. Strong digestion, easy elimination, good night's sleep. Balancing both sides of the brain. Start a relaxation response. So my feet is together. A powerful relaxation response is a prayer pose to the back. See if you can do with me. Put your hands together. Slowly turn your hand in a prayer pose. Stay here Close your eyes. Breathe out longer than breathing in. Count of 2 in, count of 4 out. Count of 3 in, count of 6 out. You'll see your hand will start going high up. If you do the eyes closed, you will see your relaxation sets in better and better. Now what you do, I'm right-handed, right-footed. Let me see if I can stand on my left foot. I'm standing on my left foot. 10 seconds, 20 seconds, 40 seconds. Then I do one impossible task, which is closing your eyes and stay on one foot. This is a sign of health. This is a sign of effortless practice and effortless breathing. Very difficult. I've been doing for a long time, still have a hard time doing it. Close your eyes and see if you can stand on one foot. There's a lot of physiology behind it, but remember, if you can do it, you are in a perfect health. Self-care. You do all these parameters. How much is your cardiac stress test? Yes, we also do a cardiac stress test. We do a cardiac stress test better than even running on a treadmill. I do run on a treadmill, I do weight training. So doing now in the opposite, in the right foot. Standing in the right foot now, 1 foot. 10 seconds, 20 seconds, 40 seconds. Close my eyes, see if I can stay on my right foot. So, balancing practice with relaxation. This is a unique practice if you do Kapalbhati Pranayama. We really do not practice pranayama standing up because pranayama causes a little altered sense of consciousness. We always practice pranayama sitting down or also even in the bed. But Kapalbhati Pranayama is very relaxing response. So if I want to do a, say, balancing pose, Vrikasana, I'm putting my hand. Also when you do Vrikasana, putting your hand in the back, it becomes a lot more challenging. Sorry. Then what you do here, on a Vrikasana, you do a Kapalbhati Pranayama. It is a sure sign of activation of parasympathetic tone, and you will be able to see it on your heart rate monitor. It's not the how high your heart rate goes high up, it is the how fast it comes down and what is your level of resting heart rate. In exercise is sympathetic. The heart rate goes up, blood pressure goes up, respiratory rate goes high up. But then body's defense, parasympathetic activity comes in. So opposite side. Now we are doing Vrikasana in the opposite side and also doing Kapalbhati Pranayama. So these are the signs of health. These are the self-practice. Self-care is healthcare. Kadi Chakrasana, west rotation with movement and breath, eyes closed. This is called a moving meditation. In a state of meditation, your mind quiets down. Hand in the front, Breathe out first. Take a deep breath in. Breathe out and slowly turn your body all the way to the back. And in the same breathing cycle, come back in the front. Then do it with your eyes closed. Have your eyes closed. Breathe out first. Take a deep breath in. Slowly go all the way to the back. Closing your eyes and paying attention to your breath. Same breathing cycle, you come back in the front. Breathe in, breathe out. Continue this few times, you will be in a profound level of relaxation. Next, self-care for your health. Able to put your head below your heart. When you bring your head below your heart, pressure inside the brain goes high up. We call it an increased intracranial pressure. Pressure inside the eyes goes high up, call it increased intraocular pressure. Pressure inside the carotid arteries and all the aorta goes high up, called the intracarotid and intra-aortic pressure. Keep your head down for a while. First, your head face will be flushed. Your eyes will be watering, but if you keep it down for a shorter period of time, you will see the time will get bigger, longer and longer and longer, and slowly you'll be able to see you're totally in an effortless practice. That is really called an effortless breathing. What it is, it's called Annamaya Kosh to the Pranamaya Kosh. Annamaya Kosh means my physical body. If you create imbalance in the physical body, it shows up in your breath. Once you can put your head down properly, the way we do it, call it like a Shirshasana, the headstand, and I'll show you the steps we do it in our self-care. It is a profound relaxation and profound your parasympathetic activation. So the way we practice our head down will be it's called Prasharito Uttan Asana with Kapalbhati Pranayam. Wide spread hand touching your feet. So I'm putting my feet as far as it goes, slowly coming down, put my hand down, and if you can see me, slowly my whole head will come down into the ground. My hands are holding both the leg. I'm comfortable enough, I'm talking, I'm breathing, and I'm doing Kapalbhati Pranayama. We continue for a long time. Generally, I do few hundreds, 2, 3, 4, 500 of this in a daily practice, and it's a wonderful sign of health. Another sign of health as a self-practice is incorporating Bhastrika Pranayama with your asana practice. Best way to do it, if you can see that I'll be doing sit-ups with bellows breathing. It's a wonderful practice. Take a look. Active inhalation, active exhalation. Just simple 20 times. Let's take a look at my heart rate. (142). I'm in a stress test level. My maximum heart rate will be 150. Maybe 165, 170, 145 to 150. I'm achieving 90% of my expected heart rate by simply 20 sit-ups with your Bhastrika Pranayama. So in the morning, after all the rituals are done, you are doing a practice of asana and pranayama. The pranayama practice, you can take a look at when you do pranayama, and we do rotate our asana practices. Like we will do a sun salutation one day and do a moon salutation another day. But we practice pranayama daily. So it's a 1 hour of practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. We do the daily Jalneti, neti part, so do some drainage when you are doing our pranayama practice. So daily self-care boils down to the practice. We'll show you another time, but I'm showing you what the practice for health is. Once you can do a proper your Kapalbhati Pranayama, abdominal lock, Udya Nibbandh, Agnisar Kriya, you ignite your digestive fire. Strong digestion. Digestion in yoga means converting the food into 7 tissues. Remember, our body tissues are getting replaced. It's called apoptosis. My liver cells are growing, performing its function, is dying. I'm replacing a liver cell. I'm not eating liver to replace my liver cell. I'm eating a piece of bread, a piece of little rice with some veggie, maybe a little protein, and I'm forming a kidney cell, liver cell, muscle cell, bone cell. It's called 7 tissues, saptadhatu. Plasma, rasadhatu, red blood cell, raktadhatu, muscle cells, mamsadhatu, fatty tissue, medadhatu, bones and joints, Osti Dhatu, nervous system, Majja Dhatu, reproductive tissue, Shukra Dhatu, and then forms a substance called Ojas. Morning is a kapha time, digestive fire is low, so try not to have a big breakfast. Totally, completely opposite of Western concept. Have a big breakfast. Big breakfast, the breakfast is not going to be digested. If you really want to have a little good time breakfast, push your breakfast a little later. I'll say around 9 o'clock. Between 9 to 10 is a good time. After that, do your day-to-day activities. Lunch is your main meal. Between, we say that pitta time is between 10 to 2, so 12 to 2 is a good time for lunch. Lunch consists of 6 taste and 7 coloring fruits and vegetables. Very simple yogic food. When you put a 6 taste in the food, you cover everything. The complex carbohydrate, non-saturated fat, plant-based fat, and a lean protein. In Western concept and in Eastern concept is astringent, bitter, pungent, salty, sour, sweet. 6 taste, 7 coloring fruits and vegetables, 7 color of your rainbows called Vibgyo. Violet, indigo blue, green, yellow, orange, red. Afternoon is a good time. Napping is called kapha producing. So napping is not really recommended in yogic tradition, except the people who are low. Remember also in our body type, our young, like babies, they're in the kapha period of time. Middle age is the pitta, and later part of our life is vata. So for balancing the babies with a high kapha, they can have a little bit of afternoon nap, which is going to be helpful for them. And people who are, we don't say older, we call them mature, people who are a little mature, who are in the vata stage of life, they will have some afternoon nap. Fruit is eaten in yogic tradition as separate. Fruit has the enzymes which causes interference of absorption of trace elements. And you will see these days also, there is a lot of recommendation for the medication. Don't take this with the fruit juice. Don't take this thing with this juice. So we ate or we eat fruit again of multiple color, 7 coloring fruits and vegetables, afternoon as a snack. If you're forced to eat fruit with your main meal, you eat fruit first. Fruit has enzyme, as I call, that interferes with the absorption of your trace elements, and also called cytochrome P450, which interferes with the metabolism of the liver. Afternoon you practice a little bit of exercise. Like for us, we practice a treadmill, weight training. We do it about every other day. Because when you do weight training, the muscle keeps the contraction almost for 24 hours. So you like to do it every other day. Early dinner, to 3 hours before going to bed, and maybe an hour or two after sunset, half the size of lunch. Before going to bed, by around 10 o'clock, drink a glass of water and go to bed. In the meantime, throughout the whole day, we have a water metabolism that you drink 2 or 3 glasses of water in the morning. Then you do not drink too much water with your meal. You may drink little water before meal. During meal you don't like to, because the water will dilute all the digestive enzymes, and also you don't like to have some ice cold water, because you want the digestive process, like the enzymes and all the digestive function, to properly according to your body's inner core temperature. You don't want to shut down that digestive fire. Drink a glass of water about 1 hour after main meal. And drink water in between, because based on your thirst, and 1 glass before going to bed. People say, I'm getting up at night when I drink a glass of water. Drink little less. You have to get up once time. This is good, because once you go to the bathroom, have your or your urination, then you come back, and if it is within 20 minutes, it does not interfere with your sleep cycle. Sleep is very important, because you're like your cell phone. Your cell phone gets charged every night or every day. Sleep is like a cell phone. Sleep has a 2 component. One is called REM, rapid eye movement, at which time your mind is still awake and alert. Another called non-REM. Non-REM is the real sleep. Non-REM have 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 and stage 2 about 20% or 50%. Stage 3 and stage 4 about 50%. So it's not that how much or how long you sleep. It's a quality of sleep. So if you think you sleep 6 hours, maybe 8 hours, whatever you say, 25% is your REM sleep. So 6 hours will be 1.5 hours. Non-REM sleep will be about 4.5 hours, of which 50%, just a little over 2 hours, you need for a deep sleep, at which time body does all of your repair process. So let's finish today with showing how we sleep as a self-care for healthcare from yogic perspective. So 2 people who sleeps very well. So I put a quiz for you. Before I give an answer, if you're listening to me, and if you can put an answer in the comments on the Facebook Live, I'll appreciate. Then I'll come back and tell you 2 people who sleeps well and who has a perfect sign of health. Okay, I better tell you, I know you have already finished written. Sleep like a baby. Baby sleeps very well and sleep like a yogi. Yogi sleep. Now let's see, how do they sleep? Have you ever seen how baby sleeps? Baby will sleep in an asana which is called Supta Baddha Konasana. Laying down closed angle pose. Okay, let me see if you can see me. Yes. So we'll put our body down. Generally we put a head like a chin below your forehead. If the chin is staying high up, you can put a little bit of a pillow here. And baby will put both the feet together like this. And underneath, you see me? Yes, you can see now. Now, if you have a problem this way, you can put two pillows on the side, put your hands on both sides, palm facing high up. Next thing you'll see a baby. When babies relax, baby does called abdominal breathing. So bring abdominal breathing. Put your hand, when you breathe in, abdominal wall will go high up. Breathe out, abdominal wall will go down. Breathe in, breathe out. Like to do it about 15-20 times. These are preliminary to your sleep. You will fall asleep. Next, you incorporate breathing out longer than breathing in. Same abdominal breathing I will be doing, so I've been doing for a long time. What I will do, I will breathe in, breathe out first. Breathe in with the count of 5 in, breathe out, count of 10 out. Breathe out first. Breathe in with the count of 5 in. Breathe out with the count of 10 out. Breathe in with the count of 5 in, breathe out on 10 out. We'll do generally about 10 times. It is the second step. 20 abdominal breathing, 10 breathing out longer than breathing in. Then we incorporate breath holding. The technique of breath holding is 1:4:2. Breathe out first, but breathe in with the count of 4 in. Hold your breath for count of 16. Breathe out with the count of 8 out. You can increase your timing if you can, complete effortlessly. Like now I will do, breathe in with the count of 5 in. Hold your breath for a count of 20. Breathe out with the count of 10 out. We continue this again for about 10 rounds. Breath holding for a ratio of 1:4:2. Breath holding builds up carbon dioxide. It acts like a CO2 narcosis, carbon dioxide narcosis. First we breathe in your fetal position on the right side. Put our head on the right arm. This way it opens up your left nostril. Left nostril is cooling, parasympathetic. Chandravedi Pranayam. Our inner core temperature is still high. In a sleep, our inner core temperature goes down and the muscle gets relaxed. Left nostril breathing brings a balance. It cools down the inner core temperature, so slowly get into sleep. Once you develop that inner core temperature sleep, you turn on your left side. Now you sleep on your left side. You can also put a pillow if you want and put your body in a fetal position, hand on this side. Now your right nostril is open. Right nostril is bringing warm. The right nostril is sun energy, Suranari, sympathetic, and the body core temperature is down now, and it's a cooling inside. Right nostril is heating. It is balancing our body and mind. It also relieves the pressure on inferior vena cava, which brings the blood supply back to your heart. So increase in your preload, the blood coming through your heart, and because of the relaxation, you reduce the afterload so the heart can pump better. It brings a very efficient heart function during the whole time you sleep. You will be sleeping very quickly, and you will be surprised that how quickly you fall into deeper sleep. If you have a tracker, the sleep tracker, you will see you have a highest amount of deep sleep when you sleep in the left side in a fetal position. And I told you at the beginning, when you get up, don't get up suddenly, straighten up your leg, put your hand, and when you get up, sit down. It's a rule of 90 seconds, 30 seconds you sit down to balance your body's physiology. 30 seconds you breathe effortlessly, breathing out longer than breathing in, and 30 seconds you get up. Not to have a postural hypotension, and continue your whole day care, DINACHARYA, which is a self-care. We've been doing it for years and years, feeling younger every day, healthier every day, and as I said, when you are in a relaxation response, like what we do, you ask me to do any asana, I will be able to do it. Because a real therapeutic asana is not trying, is all letting go. You let go all of your tension, let go all of your tightness. You are in a proper, relaxed environment. You are in a perfect sign of health. Health is a relaxation response, parasympathetic activation. Tightness is disease. Ultimate tightness in our body is called rigor mortis. I hope if the physicians are here, they will know what rigor mortis is. Wouldn't want to get into that. Stay relaxed, stay healthy. Thank you for joining. We'll be joining again next Saturday, hopefully. I have a couple of sessions. Let's see. Yes, tomorrow I'm teaching a whole day, a yoga teacher's training. And then next Sunday comes, we'll have our yoga therapy retreat throughout the whole day, 8:30 to 4:30. But we'll do a Saturday morning class. We'll do it. Okay? See you next Saturday. Bye-bye.